Good afternoon, everyone, and welcome to today's webinar. Thank you for making the time to join us for this national conversation. We are today exploring and unpacking the Every Moment Matters report released this year by MND Australia. This report looks at the human, the social and the economic costs and toll of MND in Australia. MND Australia acknowledges the traditional owners of country throughout Australia and recognises their continuing connection to lands, waters and communities. We pay our respect to Aboriginal and Torres Strait Islander cultures and to elders past, present and emerging. Aboriginal and Torres Strait Islander people should note that this document and presentation may contain images of people who have since passed away. Today we're unpacking the Every Moment Matters report. This report was released by MND Australia a few months ago. To develop the report, we commissioned independent health economists to develop the economic model behind the report and engaged an advisory committee to oversee the report's development. The committee included two of our speakers today, as well as leaders in MND research in Australia, our state MND associations, and people living with MND. Every day in Australia, 2 people are diagnosed with MND and 2 people pass away. Time is not on our side. So today we're asking, what do the numbers really mean? What has changed? What's failing? What needs to happen next? And how can each of us help? My guests today bring both lived experience and clinical insight, and I'm really delighted they made the time to join us. We'll also be hearing from our sponsors of the report, Biogen and Neurologist. We can't do this work in isolation, and their support enabled us to bring this report to you. So I look forward to welcoming Fiona from Biogen and Michael from Neurologist later. Ultimately, MND can't wait until there's a cure. We need care for everyone impacted by MND in Australia. Start with, I thought I'd take you through some of the key findings and statistics that the report uncovered, and then interview Rob and Todd, who'll be joining us. The report's underpinned by a model that was developed by the health economist to help us model, in the first instance, the prevalence of MND in Australia. We don't know exactly how many people have this disease, but by looking at data from state associations and data from the GRIM database, AHW's Australian government death data, we were able to most accurately model that there's 2,752 people in Australia living with MND. The modelling also showed that this will grow to 4,300 by 2050. To validate this modelling, we tested it against international benchmarks and also ABS data. Sadly, this model also shows that this year, 896 people will pass away from this horrible disease, and that number will grow to almost 1,500 by 2050. The impact on carers and families is staggering. Each year, almost 5.5 million hours of care are provided by carers in the MND community, and this equates to over $200 million in unpaid carer hours. The years of life lost is truly staggering. 15,760 years lost each year prematurely to this disease. We know the life expectancy of this disease is 18 years less than the Australian average, and this equates to an economic impact of $3.7 billion a year. In fact, I might flick to the next slide to take you through how we came up with the economic numbers behind the report. The economists looked at the direct cost of the disease, the indirect costs, and the broader societal costs. These costs are detailed further in the report, and you'll see the assumptions and data sources for the modelling in Appendix A. Essentially, what the model found was that MND costs Australia just over $5 billion a year, with about $500 million being in direct costs, the costs associated with government funding programs, hospital admissions, clinics, and associated allied health work. The indirect costs, looking at the costs for carer lost wages, the premature mortality, and the societal costs, looking at those broader societal productivity losses associated with the disease. $5 billion a year. But more than that, it's the cost that this disease has on the people, the 2,700 people who have this disease. At MND Australia, we're working really hard to make sure our work helps people now, helps people with their disease, with this disease, and their families and carers. Todd, I'm really pleased you joined us today. Thank you very much. You're living with MND. I'm keen to know your views on what the numbers around the $5 billion broader societal cost and the unpaid carer costs mean for you and for the MND community.
Thanks for having me, Claire. Yeah, well, I think no doubt it tells us it's a very expensive disease, not just on federal and state economies, but on individuals and their families living with MND. When you look at the impact, you're talking about a significant amount of not just lost wages and lost working hours for people living with MND, but also that of their carers. But then you've also got the cost of allied health and the costs of the medicines that come with the illness. Things like home modifications, car modifications, and then there's, of course, things that are needed as the disease progresses with things like wheelchairs, walking aids, shower chairs, and so on. And I think one of the things that's quite unique to this disease is its progression does mean that mobility is lost over time. So the costs and challenges of supporting someone living with MND does go up over time. And then that also shows the impact that you mentioned, the significant impact it has to carers who aren't just doing a 9 to 5 job in looking after people with MND. At times you could almost consider it a 24/7 job.
I'm really sorry you're in the situation of having this disease, Todd, but really appreciate the insights you have to share with us and what we can do to help you and everyone in the country who has this disease. More than 60% of the people with MND are 65 and over. The funding discrepancy between the NDIS and the aged care funding program means these people receive less than a third of the funding support. What does the funding gap mean in practice?
Well, it's significant in more ways than just the funding gap. I think it starts initially with the service experience for those receiving aged care. And it's sad to hear sometimes the service experience as those over 65 go through and the time it takes them to receive the home care packages. And then the challenges they go through in their process to be approved for that. And just being approved for it, that sometimes can take up to 18 months. So whilst that's difficult, then you've got the funding challenges. As you said, it's about a third of the funding of NDIS, but sometimes it's even more than that. And that, I think, means that people over the age of 65 are living with choices that they have to make on where they'll get their support. So they'll be looking at doing decisions or offsets where they might decide, well, I'll pay for this myself, such as home modifications or bathroom modifications, so that I can get the care into the home that I need as the illness progresses, because it is a huge expense to bring people in to provide that care. So I think it's significant. NDIS would have a expedited pathway to getting on NDIS for people living with MND, and that's terrific that MND Australia and the state associations have really been able to lobby for that. And that's something I think that we could lobby for, is a much more expedited pathway in the future, as well as more consistent funding.
Yeah, I agree. Very interesting insights. I'd like to just quickly flick to a poll of the audience to ask you, what do you believe is the most urgent need for people with MND? I'll give you a moment to answer in the poll that's popped up on your screen. Of our four options, faster access to care, more support for carers, new treatments, and greater awareness and policy action. Interestingly, faster access to care and support came out as the leader or the highest, most urgent need in the poll, followed by new treatments and research. Todd, the average life expectancy for someone with MND is 2 to 3 years. What does timely care mean when you're living with that kind of ticking clock?
Yeah, I must admit, with the poll, I was looking for a button that said all of the above. Um, but look, when you consider how fast the disease moves on most occasions, unfortunately, people will progress and their care requirements progress beyond what they're receiving while they're waiting for bureaucracy to move. So they really, well, I should say, we really don't have time to wait for decisions to be made, for equipment to arrive, to get on aged care or NDIS. And I think there's huge opportunity for improvement here. I can think of times, I was talking to someone about a wheelchair delivery recently, and they were talking about, an average time to deliver the wheelchairs through NDIS was taking around about 12 months to 2 years from it being ordered or requested through to it arriving at a person's door. And in that time, the person is not only renting another wheelchair, which is a cost that ends up quite often being more than the actual cost of the wheelchair itself, but they may progress to a point where the existing wheelchair that they're getting is not right for them. And that's the case with anything to do with MND. So we really need to keep working on expedited pathways, not just for getting onto NDIS or the aged care packages, but we really need to be working through things like how fast can we get decisions made? Because unfortunately, the illness is progressing and it can't wait for decisions to take, 6, 9, 12 months to be made.
Absolutely agree. The other area I hear all the time is the delays in getting access to people who understand the disease, healthcare professionals who have that specialist MND understanding. I know often I hear people say once they're connected with a state association, the world changes. I was wondering if you could talk us through a little bit about your experience and about the importance of getting those specialist MND services.
Yeah, so obviously we have access to our state associations and the MND advisors or support coordinators, which are amazing. But it's difficult to have all the knowledge that's in their heads, which is immense. There's just such a significant opportunity to actually understand when you want to get, say, a speech pathologist or a physio or a psychologist or a dietitian, occupational therapist. It's difficult when they sometimes arrive and they don't have the skills to assist. And unfortunately, it sometimes means that people might have waited a couple of months for that person to arrive or to go out and get that appointment to only be told, look, I just don't have the skills to help you. So I think the opportunity to create like some sort of registry where we can see who is experienced, who's done training, who's supported people with MND before, so that when we go and get that care, they're ready to go. And I think if we do that, it could be something that allied health professionals aspire to be a part of.
Fantastic suggestion. And interestingly, one of the recommendations of the report is to develop a directory or a reference for people with MND to be able to access those specialist service providers more quickly. If there was one action that policymakers, that governments took away from this report, what would it be and why?
I'm going to go a little bit left of field on this one because we haven't talked about it, but I think it can have an impact very quickly. And that is a singular data register for all of our data across MND. And to give you all a bit of background on this, we have data in state associations, we have data in medical practices, we have data in the MND registry, and also in other places as well. And if that could be centralised, it could then lead to some really deep insights into trends leading up to the disease, the time it takes to be diagnosed. It could look at demographic and geographic information that looks at, say, regions that are more prone to the illness. And then it could, we could run artificial intelligence across it. And then I'm passionate about the fact that we could get health information from people living with MND. I get some of my best tips from people living with MND around things such as diet, around things such as what they're doing to live better lives, to feel more comfortable, and the like. So I think if we could get some more of that information, we could then look at better ways for care, as well as information that would then go into our scientists for cure. So for me, I think that's something really, it's going to be challenging, but it's very doable. And I think that's something that we can take more control of, other than, we're obviously all waiting for a cure. We don't know how long that is away, but what we can focus on is data, and that could have a significant impact. In fact, I actually think if we do it right, we could potentially prevent some people from getting MND in the future.
You're absolutely right, Todd. The fact that we have the disparate data sets and no analytical capability across them is a barrier. And you're right. Ultimately, if we have better data sets, we can help scientists or help direct the scientists to what causes the disease and prevent it. We know we've got lots and lots of great scientists in the country working at a cure, but building that evidence around what makes the biggest difference to improve and extend quality of life is absolutely necessary, and absolutely agree with you, Todd. That's a key priority. Rob, I'd like to throw to you. You've treated hundreds, if not thousands, of people with MND. You know the science, you understand the clinical side of things. The report shows that 13 months is the average delay from symptom onset to diagnosis. What causes this delay, and what could be done to speed it up?
Well, firstly, thank you, Claire, for the invitation to talk in MND Australia. So that figure of 13 months is an average. So for people with bulbar onset disease, it might be more like 6 to 9 months. People with lower limb onset disease, it might be longer, more like 12 to 18 months. People with upper limb onset disease is probably around that 12 months. And there are many factors that contribute to the delay. I think people take a while to realize that their symptoms are not going away. It's not due to a problem in their neck or back, that the symptoms are getting worse. That takes a few months. I think GPs taking it seriously, doing investigations, referring on, that would be one point to say, well, could we educate, could we make MND more of serious or an emergency for GPs to forward referrals on. I think it takes a while for investigations to be done. I think Todd might have said, I think it was you, Claire, that we need more healthcare professionals who are specialised in motor neuron disease, and access to those needs to be in a timely fashion. Recently, the Gold Coast criteria, I think it was 2019, experts gathered in Queensland and tried to come up with a consensus for an earlier diagnosis, because the previous criteria really did rely on disease progression as a key feature. But those new criteria, which are being applied around the world, are emphasising trying to make a quicker diagnosis. I think there's a number of areas of research and clinical trials, and if we did get a therapy that clearly makes a big difference, well, we really do need to be treating people right at the onset of disease. So we need to greatly reduce that 13 months to have a therapy that works, is truly going to work when the disease is starting. So I guess those are the major things, to treat it, to take it a bit more seriously, and to have more specialists with expertise and being able to see them in a timely fashion.
Really interesting. You mentioned therapies. In Australia, we have Indaverone and Tofersen coming shortly. How do these change the outlook for people with MND, and what do they offer to people with MND today?
Yeah, so the approved other therapy is obviously riluzole. The Tofersen is available thanks to Biogen providing compassionate access to people with the SOD1 gene mutation. Of all people with motor neuron disease, that's relatively uncommon. It's about 20% of people who have a family history, and about 1 or 2% of people who don't have a family history. So that Tofersen is available. And edaravone is also available and on the PBS through Teva. And the criteria for the PBS are reasonably strict, but particularly people at the start of the disease will have access to edaravone. Clearly, we need therapies that are, going to make a bigger difference. Tofersen appears to be very effective based on the clinical trial, but we are still lacking therapies that can really make a big difference to this disease.
I should point out I introduced Indaverone as Indaverone, but it's being sold as Radicava in Australia, I believe. We also have Michael from Neurizon, who's working on a new disease that he's putting through phase 2 in the Healy platform in the States. There's a hope, isn't there? The genetic link is interesting. We know up to 15% of people with MND have a genetic link, but the other 85% of people who get this disease is unexplained. Where is the research taking us in understanding why and what causes this disease?
Yeah, so those figures are changing, and this is a good snapshot of where things lie at the moment. About 10% of people will have a family history, and the rest, 90%, don't. But genes aren't that simple. So the genetic makeup and what genes are risk genes and modifying genes mean that it's much more complex, and how they interact with the environment, and by the environment I also mean how we've lived our lives, is also quite complex. And clearly there's an important factor related to aging, because people get this in adulthood. So all of those factors are all linked. And I think you were saying before about Todd was saying about those big databases and using AI to really dissect things down really carefully would be a really important way that we can use registries and databases to better understand the cause. So, it is obviously quite complex what causes it, because we haven't come up with a clear answer yet. But the idea of the genetics is one of those major breakthroughs in the last 10 to 15 years.
It's fantastic that there is so much research being done on the disease and that we're gaining insights every day. While that is happening, caring for people in Australia is arguably the most important thing we can do. I'd like to throw to a poll to ask the audience, of the elements of care, what do they see as most improving MND care right now? Is it easier access to coordinated care, the clinical guidelines that are being developed, better care and support services, or a national data registry or data base to centralise and consolidate data and elicit those insights? Right, almost everyone's voted. And interestingly, the easier access to coordinated care, Todd's point, and the national registry and national data base have come up as clearly the two things that would make the biggest difference to improve care right now. Rob, I wouldn't mind getting your insights and views on why data is so critical, not just for potential breakthroughs to find a cure, but also around care and ideally, eventually what causes the disease. Why do you support, and what do you see as the benefit of this call for a national MND data registry?
Yeah, so I do think it's really important. It can better understand what the needs of patients are. It can understand, what the trends are, and but probably a national database, just the spectrum of disease. Australia is quite special in that we've got state-based things, but we're also quite special in that there's a lot of regional and remote Australia. So being able to capture the whole of Australia, not just the capital cities, I think having a proper national registry would be really important. But if it's wide, and you want to be able to have data easily able to be put into the database to better understand what the burden of the disease is and where patients are being helped.
I think there's clear agreement, and certainly I hear it from people with MND. They want to contribute their data and they want better data analysis being done around cause, care, and cure. So clearly a key priority for MND Australia. Todd and Robert, I was just wondering if you had any reflections on that poll and what's come out that coordinated care and the support for the database are, by this audience, the two highest priorities.
Yeah, so I mean, coordinated care in proper multidisciplinary clinics with the involvement of allied health, specialised nurses are really, really important, and people who are specialised in motor neuron disease have grown in. When we first set up a clinic 20 years ago, there weren't any organised clinics. But now all states have that available to them. So I think it's important that I think the report stated the improvement by up to 2 years in terms of survival. But I think it's actually being able to provide the care and support in combination with the associations that's really what's what's important.
Absolutely. And that continuity of care or connection of care between healthcare and community care. Todd, you're on the board and current interim chair of MND Vic. How do you see that care provision in Australia and the fact that this audience rated it as the highest priority for people with MND?
Well, I think we know that a really strong multidisciplinary care team just helps improve quality of life. But it is not always easily accessible. So we do have specific places within many of the capital cities, but it is quite challenging for those in regional areas to access some of that. So there's still more work to be done. I mean, it's terrific to be able to go into some of the places where you can receive that coordinated care all in one spot. But equally, they can't, do everything for every individual coming through. So, there's still more work to be done there to improve that care. And I think the registry of professionals would certainly help there.
Very good. We might, in a couple of minutes, we'll throw to some questions from the audience. But Rob and Todd, I was wondering if you had any questions or comments for me or on the report.
Might start, Claire. One of the things we've talked a little bit about and the report recommends is a nationally consistent funding pathway, regardless of age. What difference do you think that would make immediately?
In Australia, there's obviously two funding programs that support people with MND, My Aged Care and the Aged Care System and the NDIS. And the difference between them is staggering. And I hear from people with MND all the time that it's unfair and unjust. A consistent pathway would bring the two programs together and mean all people with MND could access the services they need. We are lobbying government for exactly that and for it to be modelled on the NDIS. The comparison between aged care with the new supported home program, so the reforms that have just come in, and the NDIS amounts to $200,000 a year at least between the funding provided to an individual. The NDIS has an expedited pathway, whereas aged care, even if the fastest turnaround, can take many months. And the flexibility around what you can use that money for, as well as the co-contributions, mean that people diagnosed 65 and over receive a second tier support system. So our advice to government is to dedicate or develop a dedicated funding program and expedited pathway and access to the program for all people with MND in Australia. I think it would make a huge difference across the country right now.
So Claire, we heard about a very substantial average household loss due to motor neuron disease. I think the figure was 133,000. What would help families cope more sustainably?
Yeah, look, I hear all the time from families who are financially crippled and bankrupted by this disease, as well as the emotional toll of watching someone they love decline with this disease. I think there's a whole range of things the federal government can do to help families and to help people with MND, not only what we've spoken about in terms of better care service delivery, better funding for clinics, better funding supports for people with the disease who generally stop working when they get the diagnosis, and their carers who often end up giving up work, but also better carer support and more flexible approaches to the way we run respite and disability and aged care accommodation as well. There's a lot of work across the board that state governments and federal governments should be doing to help ameliorate that 133,000, but to help these people when they need it.
Well, 1 in 3 people with MND wait over 6 months for essential services. What do you think's one thing we can do to fast track that today?
There's a lot, isn't there? I think one of the things I'm really keen to see is all people at diagnosis be referred to their state MND associations. These associations have people on staff who can help them get access to funding support, access to equipment, and access to those specialist MND service providers and allied health. The same as when people finally get to a good multidisciplinary clinic. I hear all the time that it changes their life. Between clinics and associations, that's where you get the expertise that you need, and that's what makes the biggest difference for people with MND across the country.
So here's a question to both of you, a person living with motor neuron disease and those who are providing support. But what gives each of you hope, whether it's in science, care, or the community? What's giving you hope at the moment?
I'll let you go first, Todd.
Well, I would say there is an extraordinary amount of work happening across cure and care. The state associations and MND Australia are constantly working on this. They're not just providing care services day to day, but they're looking for better service. And the fact that we've got people like Clare and the state CEOs means we have access into some of these places to look for ways to improve and expedite the care that people receive. And then I'm just excited by a couple of the initiatives. I think the data initiative will happen, and I think that will be significant. And I think, I think whilst cure is a little bit out of our hands, I think some of the care initiatives we have a lot more control over.
So it's kind of the same thing that gives me hope. One of the things I love about the MND community is that it is a national community and that people share information and insights and tips. But the other thing that really gives me hope is I was talking to David Berlowitz, who's our NIV researcher and expert in Australia. If NIV can improve quality of life and extend life by 18 months, Dave's convinced that there's other areas, better evidence can help drive research to help us improve and extend quality of life for people with MND, movement support, nutrition. There's a whole host of areas that we need to do more research in so that we can better target the care and services for people with MND so that they can live better for longer. So I think there's sort of two answers to that. One is the community and the sharing, and the other is the research and insights into how we help people with MND now. Rob, I'm going to throw back to you. What gives you hope?
Yeah, I thought you might. Look, there's a lot of research energy. There's a lot of people who are used to start in MND research, but without funding and better opportunities elsewhere would leave MND research. But a lot of them are staying involved in MND research, and they're also bringing through younger people with new ideas. I like what you said about it being a national disease, because that's also happening at the research level. So those things are a real positive. That's really only been the last 10 years that's really expanded.
I'd like to thank our sponsors and introduce Fiona and Michael. Fiona Tigers from Biogen and Michael's here from Neurizon. Their sponsorship allowed us to develop this report and made this report possible. Fiona, can you share a little with us about what Biogen's been doing recently in the MND space?
Thanks so much, Claire, and thanks for letting me join today. We're so pleased that we can actually support the development of your Every Moment Matters report, because as everybody's heard, data like this is so important to provide up-to-date information and a true view on what the current situation is facing the MND community, and particularly for government audiences, as you know very well, Claire. It actually supports us and helps us as well in our interactions with government. So absolutely critical piece of work. I'm not sure if people know who we are. We get spoken about quite a bit, but we're a global biotech company, and we were founded almost 50 years ago by 2 Nobel laureates. But from the beginning, our work has centered on neuroscience, and it's one of the most challenging and complex areas of medicine. And over the decades, this focus has grown into deeper expertise in rare and devastating diseases, and a real commitment to advancing treatments where the need is greatest. I'm not sure if people have followed us, but over the last 10 years, we've been incredibly dedicated to the research and development in MND. And I have to say that, you know, we have had failures, but we feel very much that we've learned from those setbacks, and we've progressed well in our focus on SOD1 ALS, as you've heard today. However, we're not stopping there. We are continuing our research and development efforts with new molecules, and a commitment that we're looking beyond the SOD1 ALS part of the community and broadening it out. We totally understand the urgency, and we understand the profound impact this condition has on individuals and families. And so we remain absolutely steadfast in our belief that progress is possible. And we're continuing our work with the hope and determination to make a meaningful difference for people living with MND. So that's where we're at the moment.
Well, certainly thank you for that and for your time. And Toferson is providing enormous amounts of hope across the world, but certainly across Australia. Michael, you've got an interesting drug in the pipeline. Thank you for joining us, and thank you for your contribution to this report. A lot of Neurizon has really focused a lot of attention in the MND space. What are you working on?
Yeah, no, we certainly are, Claire, and thank you for inviting me to be a part of this important webinar today. And Neurizon is incredibly proud to support the Every Moment Matters initiative, and congratulations to you and the entire MND Australia team for bringing this project to life. For anyone in the audience that may not know us well, Neurizon Therapeutics, we're developing a potential new treatment for people living with MND called NUZ001. And we recently completed a successful phase 1 clinical program right here in Australia. And we're incredibly grateful, obviously, to everyone who made that possible. And I want to emphasize that point where we are deeply thankful for people living with MND, their families, their support networks who have taken part in our clinical trials, their courage, obviously their generosity and trust in what we do really drives every step forward that we take. And one of the most powerful outcomes from the work that we've been doing is the knowledge that some of the participants that were involved in our phase 1 clinical trial program are still receiving treatment today through a compassionate use program. And now that's more than 3 years since the phase 1 program started. And to us, that continuity is meaningful. It reflects both commitment of the participants and the potential we're seeing in the science that we're developing. And perhaps even more exciting is where this early work has led. And NUZ001 has been selected for participation in the prestigious Healy ALS platform trial at Mass General in Boston. That's, Mass General is one of the world's leading clinical research hospitals, and only the most promising treatments are invited into this innovative accelerated trial design. So we're incredibly proud of being part of that. And we're just a few months away from dosing our first participants, with trial results expected in the middle of 2026. So although that study is currently running only in the US, it offers the fastest, most efficient path for us to bring potentially this new meaningful treatment to people with MND globally, including here in Australia. And of course, the results need to continue to be positive in that Healy platform trial. But that gives us a sense of momentum and really provides us with hope. So exciting times ahead for Neurizon. And once again, thank you for involving Neurizon and giving us the opportunity to be involved in the Every Moment Matters initiative. It's a real honor to contribute to this important work.
Thank you, Michael, and thank you, Fiona. And I'll ask you both to stick around for a few minutes. We've got some questions from the audience for the panel. Anyone who's joining us online, if you can put your questions into the chat, that'll come through to myself and the team, and I'll direct them to the panel. The first question I've got is around, is a request or a question around, is there more detail on the environmental factors that are showing trends in sporadic MND cases? Rob, I might throw to you in the first instance, and then Todd, I'm sure you've got some data related comments as well.
Yes, so I mean, environmental is a broad term because I think people in the audience would be saying, well, what's out there that I'm exposed to? But in a lot of the research, it's a bit more than just saying that, but it's also what you're doing in your life is an environmental factor. The SALSA database, which has not continued, was looking at environmental factors. It's difficult to be definite about environmental factors. We've looked at a map of Queensland where people are living with motor neuron disease, and it sort of exactly maps the national, the population of people living in Queensland. So the people living with motor neuron disease are, seen in where the greatest concentration of people are living. So it's hard to see environmental factors jumping out when you see that map. It's clearly very, very complex, and people will be aware of some of the other research that's happened, particularly Macquarie have been looking at environmental factors. So I might stop there because I'll give a chance for other questions and Todd to see what he thinks.
I might just comment on so if we had one database for starters, which is all the information that's available out there in one place, then we could start going down a path of asking deeper questions to people living with MND, which include where they live and what they've been exposed to, and many other factors. So once that's done, then really a lot more clever data insights can be given. So this is the sort of example where completing a singular database and then expanding it with more information, more questions, but it will only work if we're able to make sure we can capture all of that data. So we've got a bit of work to do on not only bringing it together, but then secondly, to maintain it and get that information from people living with MND. But I think if we complete it, initially we'll get some initial findings, and then second time around, I think we can develop our processes to capture even more detailed data that will start answering some more information like that.
Really good answers, guys. Thank you. We have a question on tofersen and radicava, and are they designed to slow or reverse the progress of MND? Now, Fiona, I know Biogen and all pharma companies in Australia have a whole range of industry standards, so I'm not sure what you can and can't share with us, but I'd love to hear from you on tofersen and what it does for people with MND.
I saw that question in the chat and I was, oh dear. So people probably aren't aware, but yes, it is against the law for pharmaceutical companies to speak directly to the general public about medicines. It's about interfering with the doctor-patient relationship. So I'm sorry, Robert, to put you on the spot, but I'm wondering if you can answer the question.
Yes, more than happy to. Look, the original idea for tofersen was that it was slowing the disease. Some of our patients would actually probably be a bit more hopeful that it's been stabilizing for their disease. But the lack of good biomarkers is one reason that we find it hard to say, well, is it really reversing or slowing? I think it's probably fair to say that radicava is only been designed to try and slow the disease. It isn't reversing it, and the same would be true for riluzole. If we could truly have a therapy that could make a big difference in stopping the disease, our human bodies do a good job about trying to regenerate. So our nerves, do what we see in motor neuron disease is this real battle between our body trying to supply our muscles, and that's called collateral reinnervation, and it's very active in motor neuron disease. But unfortunately, whatever's causing the death of the motor neurons is winning the battle. So if we did have a therapy that could truly make a difference in stopping the disease, well, our bodies could actually be helping to reverse some of the effects.
Fascinating. And it brings all of us so much hope that there are these medicines available and more in the pipeline. We've got a question from Keith about how, do we have any insight into how the report's been received by government? And this is an interesting one. We at MND Australia have done a lot of direct representation to politicians and parliamentarians, as well as working with the public service. We've received formal responses from the Minister from Health indicating they've acknowledged the report and some of the work that the government already has in progress around the key recommendations. I was heartened recently to see the Australian Institute of Health and Welfare, the think tank for health data analysis in the Australian government, was looking at neurodegenerative diseases and weren't going to use modelling or anything other than pure data sets, but actually used our report. So I think that speaks to the quality of it. I think there's still a lot of work to be done. The report gets cited and referenced. People and politicians in speeches have referred to it, but I'm yet to see the recommendations actually turn into government funding or something that the government is doing. So I think there's a lot of good acknowledgement of the report, but I think we're still waiting to see the government actually implement any of it. And that falls to Andrew and I and the MNDA team, I think, for more advocacy and to keep up the lobbying. I've got another interesting question from Phoebe. Phoebe's a medical student and says that MND care seems to be minimally covered on the curriculum. Is there anything that patients or experienced clinicians think are important for early career doctors or generalists to know about MND care? Rob, I think this is another one for you.
Well, could be Todd as well, actually. Yeah, so it is a bit neglected, and again, MND has faced that it is less common than the bigger diseases such as cancer and heart disease, and in general, neurology does get a bit missed on curriculums. If you think about it, there's a lot about motor neuron disease that goes right across other diseases, the respiratory involvement, the nutrition, the palliative care aspects, the symptoms and diagnosis aspects. So, there is actually quite a lot, and it's quite a impactful disease that people should be learning more about it, because it just covers a big spectrum of what's important about health and learning about health.
Interestingly, I also hear that a lot of healthcare professionals and researchers are drawn to working on the disease because we know so little about it and because it is such a professional challenge. Todd, sorry, you're about to jump in.
Yeah, there's a couple of questions that I think I can answer a couple of questions in one here. There are some questions in the chat that are similar to this one, in that talking about support for carers and clinical guidelines. So that is something that's being worked on by the associations and MND Australia at the moment, and the intent is to come up with something that provides greater education both to GPs but also to allied health professionals. So I am pleased to say that work is already underway, and I think it will be hugely beneficial once it's completed.
We've got one last question before we run out of time. This is a question from Catherine. What more can be done to encourage the early uptake of NIV, given the apparent benefits? And for anyone who doesn't know, NIV is non-invasive ventilation, so breathing support for people with MND. Todd, I'd be interested in your insights and then potentially Rob as well.
I'm happy to make a start, although I don't think I'm going to get the best answer on this because I sort of had a similar insight just with regards to myself and started looking into it and was told probably it's too early, but noting that there is absolutely evidence that NIV does help extend life and quality of life. So I don't exactly have the answer, but I'm really interested to hear what others have to say about that.
Rob?
Yeah. So NIV, the original studies, and there hasn't been a lot of studies, but does improve survival quite substantially. There hasn't been any evidence in people without respiratory involvement or with normal respiratory function. So most of the time, if people are noticing any symptoms, and sometimes it isn't the obvious symptoms, it's very important sleep and sleep quality, but sometimes people just feeling a bit more anxious because they're breathing a bit too quickly. So it is important that assessment of breathing function happens regularly to track. You do spot changes over time a lot better because there's very much a normal distribution of what people's respiratory function is. But what I'd say is that if people are noticing any respiratory symptoms, then NIV can be very helpful to improve quality of life. And we'd be really strongly encouraging that uptake in that setting. And David Berlowitz is doing a lot of great research on the respiratory involvement.
Thank you, Rob. And thank you to everyone on our panel this afternoon. Michael and Fiona, thank you for your support with the report and for joining us this afternoon. And Todd and Rob, thanks for providing such interesting comments and insights. We have seen and heard the truth behind the statistics in terms of cost, money, and energy. We know that MND is brutal, but we know with the right care, the right supports, and the right investment in research and policy, we can improve lives now. I'd ask everyone who's joined us to read the report, share it, talk about it, act on it. Whether you're a clinician or a policymaker, you're living with MND or a gene carrier, every moment matters and every action will help people with MND. So thank you all for taking the time to join us this afternoon, and I look forward to seeing you again soon.
Thanks, Claire.
Thanks, guys. Bye.
Thanks, Claire.